I have an online PDF version of the 8th edition, if that's okay.
Yeah, the 8th edition is just fine. So thank you for bringing that up, actually, because that's one of the things I wanted to chat about. Okay, so you have an online, like an e-version?
Yeah, I found a PDF of it online.
Wow.
Shit.
Okay.
Like insane.
You are resourceful, Emily. You might be able to share how you did that with other folks if they are having a hard time.
Yeah.
Thank you for that. Oceana, I thought I saw your hand pop up and then back down, maybe? Or
that was an accident.
Oh, okay. Margaret, your hand is up.
I found mine on Amazon, but it's an ebook.
Okay, so they also have ebooks. That's fabulous.
But I had to download Kindle to get it.
Kindle.
Oh, okay. So just a different sort of application so you're able to read it, maybe.
Yeah.
Okay.
To read it and listen to it at the same time.
Oh, fabulous. Oh, I love it. Okay. So those of you who are having some trouble, hopefully, between what Margaret and Ariel and Emily shared with us, that gives you a couple of more ideas of how you can get your hands on the book. Emily mentioned that her PDF version is the 8th edition. That's fine. So the 8th edition, the 9th edition is fairly new. It just was released last year. There's not a ton of changes between the 8th edition and the 9th edition. So the 8th edition, it will be okay. I will let you know, though, that some of the page numbers aren't going to jive up and there might be slight differences in it. So if you're noticing things, it'll be a little bit more important for you probably to stay on top of reading so that you'll recognize those things. But aside from that, there's not a ton of change. Little bits. There's some extra sections, some extra
Frozen. What the terrible Frozen.
Okay. Mine is on. Yes. So Michaela is saying that hers is on back order. Yes, the ones from the college are on back order. So I was a little bit worried that was going to be the only place that people could get the textbook. So I'm glad that there are some other options. Hopefully, Follett Library. So Follett is the bookstore. So if you've ordered from Follett, you're ordering from the bookstore, and so that's where it's on back order. Not sure how it works in terms of whether you're able to cancel that order and do something different, or whether you just kind of have to hang tight now that you've ordered it that way. I'm not really sure. Yes, so Follett Bookstore is the college bookstore. Follett is the company that is contracted by the college. That's who our bookstore is. So are you saying, Mugaxi, that that's where you ordered yours from? Okay, Meadow called the bookstore. They're working on a refund. Okay, nice. Okay, so the bookstore is, according to Meadow anyway, they are giving refunds. If you've ordered and you're tired of waiting and you want to get yours a different way, contact the bookstore and do that. It is going to be important that you have your book. I feel horribly that it's on back order. This isn't the first year that that's happened though. And usually it's within the next, like usually by the next class, most people have their books. It will be important to have something fairly soon because you don't want to fall too terribly behind. Your first test is going to be in a couple of weeks, and I'll post once I get a better feel for what the semester is going to sort of look like. My course map is kind of thrown out the window this year because nothing is going to jive the same way. And as soon as I have a sense of when that test is going to be, I will let you know for sure. And it'll be chapters 1 to 4, I believe, is what's on that test. I can let you know that now. Ariel.
Hi, I just checked Amazon, and the Kindle edition for the 9th edition is $18.01, and then the physical edition is $139.
Wow. So if you're the kind of person that can use an thank you so much for that, Ariel. If you're the kind of person that can use an ebook version or an online version, it's a great option for sure. I know myself, I need paper. I can't read online. I have issues in terms of I've had a concussion in the past, and so I have a really hard time staying focused online. And I'm old, so I like to highlight things and write notes in the margins, those kinds of things, and you can't really do that online necessarily the same way. So for me, I like to have a paper version. If you are able to do this without a paper version, that's awesome, and it sounds like you can probably save yourself a little bit of money by doing it that way. So that's great. Thanks you guys so much for being so helpful to each other. That's awesome. Any questions about the textbook? Carmen?
Very weird. And the first time I heard very false.
I can't hear you. I'm sorry, Carmen.
Sorry? They say false? False. Oh, really? No, the guy say something.
Your mic is on. I see your mic is on, but I'm not able to hear you.
See?
I'm not sure. Oh. You are really cutting out. I'm not able to hear you, Carmen. I don't know if you can hear me. If you want to put it in the chat, if you have a question, I can read it then.
There they need the work a lot. Not yet finished, but they say they send
Sorry, Carmen.
They need the work for my standard fast. So I notify.
Okay. Looks like Carmen might be having some technical difficulty there. Okay. What's the textbook called again? The textbook is called Administering Medications. This is the new version. That's what the new, I don't know if you can see it. Looks like there's a glare on my picture. It's called Administering Medications, Pharmacology for Healthcare Professionals. It's the 9th edition, is the newest one, and that's the one that's on our course outline. The old one is the 8th edition. It looks like that. And that's okay if that's the only one that you can find. That'll be okay. You will survive with it. It just might have its share of, little pains in the butt as we go through with things not matching exactly for page numbers and stuff. But in terms of content, it hasn't changed that much. Do you have another question, Carmen? Oh, I see it. Thank you. Perfect. Good. Okay. All right. So, if there aren't any more questions about that, I am going to share the PowerPoint. So,
when we say mirror.
Here and here. And PowerPoint on your screen.
You can see.
Yay me! Okay, perfect. Awesome. Okay. See, my anxiety starts to come down when technology works. Amanpreet, I think that was, that just popped up with a question. Thanks, Viet. Did somebody have a question? Okay. Hang on to your question if you do have one. And let's get rolling, so maybe we won't be here till 1 o'clock this afternoon. Kidding, I have another class. I can't be here till 1 o'clock this afternoon. Okay, so this PowerPoint, I will just let you know, I uploaded it quickly. Oh, thanks, Amanpreet. Sorry, your hand went up. I uploaded this PowerPoint last night, and this is why I like to do things at the last minute and kind of review things. I actually didn't review the PowerPoint, and so there's a thing at the end that just says what you need to do next in prep for next class, and you'll just ignore that. I was going to delete it, and I didn't realize it was there. So when we get there, I'll let you know. I think it tells you to read a chapter that we're actually not going to be covering next week. So just ignore that part. Pharmacology, this is just a bit of an introduction right now that we're going to do. We're just going to kind of do an overview on what pharmacology actually is. And again, we're going to focus more on, because what I think is really most important is you guys understanding what your role as DSWs, as future DSWs is in terms of medication administration. And so this is the place where I often put a little plug in for DSW. And so we have so many amazing social service field out there, social work, rec therapy, all of those types of disciplines, which are absolutely amazing. And you gain a great deal of skill in those areas for sure. Great deal of skill in terms of supporting people of all different abilities. What separates DSW, though, from those other courses are really two main things. One is pharmacology, and one is behavior. So in the 2-year program, you take 2 behavior courses. As accelerated students, and I don't think there's any in this class, anyway, they take 1 behavior, and everybody takes pharmacology. And so it's kind of what separates us in our program from other programs in terms of that separate skill set. And it's the reason why DSW is preferred in terms of employment in our sector and in the school board. And so in the school board, in supporting children with disabilities or high school students with disabilities in the classroom setting as an SSP, DSW is preferred education. And the reason for that is mostly because we do teach specialized areas like pharmacology and behavior, for example. And so we're a little bit unique that way, and so be proud of that. It's a lot of work, but it's a skill that's really important out there. And so worth our extra time for sure. So DSWs and medication administration. So administering medications really is a fairly new role in terms of our sector and sectors like ours, like social service sectors. Typically and historically, medications were the domain of certified healthcare professionals. So certified being nurses, registered nurses, doctors. That would typically be the only person or people who would be administering medications to other people. Now we see that as having changed quite a bit. We have more and more professions out there, more and more people getting support from non-registered, non-certified professionals who are administering medication to them. again, people who work in the field who aren't DSWs are being trained to administer medication on the job. They have this particular amount. So, what is pharmacology? So, in a nutshell, pharmacology is the study of drugs and how we use them. That is what pharmacology is. We're going to delve a little bit deeper in this course. We are going to talk about drugs, and we are going to talk about how they're used. We're also going to talk about some of the interesting differences in the ways that we use medication in our field. So there are some unique ways that medications are used for the people that we support that aren't necessarily used that way in the quote-unquote general population. People with developmental disabilities have brain differences. That's part of their developmental disability. And so drugs, medications, affect them differently, and they have different impacts on things like, say, their behavior than they would on somebody else who might take a medication, the same medication. And so a really interesting sort of ways that medication is used in our sector. Again, I mentioned briefly, because I just kind of, rode on Julie's coattails in orientation and said I basically just followed her in our careers, and we have. And so I didn't speak specifically about my role when I worked at St. Joe's. Julie did a little bit, though, in the dual diagnosis clinic at St. Joe's. And so for a number of years, I was the dual diagnosis facilitator, and I worked alongside Dr. Bartolucci, who is since retired from our sector, but he is a psychiatrist who specialized in working with people with developmental disabilities. And so as being a part of that clinic taught me a great deal about just what I was talking about how certain medications have an impact on the people that we're supporting in a really unique way. And so Dr. Bartolucci would use combinations of medications that you never saw in the general population, that were actually quite effective in people with developmental disabilities. And so I'll bring some of that into this as we get onto those chapters. I won't jump too far ahead because you'll just forget anyway. But when we get to those chapters where we're actually talking about those medications, we will talk about what, some of those, what we refer to in the sector as off-label uses. And so not necessarily what that drug was intended to do, and not really a reason why the drug was intended to be administered, but we've discovered, and I use we as in, people in general, doctors, researchers, and scientists have discovered over the years that they actually do work in a really unique way in some people, and so now they're being used that way. And so we'll talk about that. So pharmacodynamics is the study of the biochemical and physiological effects of drugs on the body and on microorganisms or parasites within the body. So this is where we talk about what is the drug actually doing in our bodies to cause a specific effect or a specific outcome. An example of that is that SSRIs inhibit serotonin reuptake. That's what they do. So SSRIs, we'll get there, are antidepressants. They are a type of antidepressants. And the way that they work is by inhibiting the amount of serotonin that is being taken into that's being utilized in the brain. Different antidepressants have a different way of working. And so that's what pharmacodynamics is all about. Okay, here's this particular drug. This is what it does. It's an antidepressant. It makes you happier, but how does it do that? And so that's the pharmacodynamic part of it. We are, again, just going to skim the surface of that stuff, really just to kind of build an awareness in you that it is different and that different medications do work differently in our bodies. So not going to go too much in depth about some of this stuff. So again, don't panic. But we are going to talk about some pretty cool and interesting things about the way drugs work in our bodies. The area of pharmacokinetics is the area that studies what the body does with a drug. So including how the drug is absorbed, so how does it actually get into our system and move throughout our system, so distributed. So if you take a medication by mouth, how does it end up doing what it needs to do in your hand, for example, if you have pain in your hand, those kinds of things. We'll talk about how drugs are metabolized, so what our body does with that medication once it's in our body, and then how is it excreted? Because if we didn't ever excrete or get rid of the medications that we ingest, that's when we become toxic, is when our bodies aren't excreting those medications, and that can be really dangerous. And there's several different ways, depending on the medication, that we actually excrete medication. And so we'll talk about that again. Important to know, because if a certain medication is excreted through the urine, and you're noticing that a person that you're working with hasn't been, for whatever reason, maybe they're not drinking enough, whatever reason, but they're not using the toilet, they're not going to the bathroom, maybe they have a bladder infection and they're not able to pee, they're not excreting that medication. So what's important to know about that, right? So those kinds of things, this is how we make those connections. So an example here is that ethanol is oxidized, and here we go with this pronunciation stuff. It doesn't matter how many years I practice. Acetaldehyde, so it actually changes, so it oxidizes from ethanol to something else, mainly by alcohol dehydrogenase, which is a hepatic enzyme. So alcohol dehydrogenase is an enzyme. Hepatic, anytime we see that, and you'll learn this as we go along, means it's happening in the liver. So anything that's liver related, you'll notice the word hepatic. So again, just wanting to give you guys a glimpse so that if you're sitting in a doctor's appointment and the doctor says something and he uses that term, you can be like, oh, that's right, that means this. And then you kind of know what he's talking about. So anatomy, so some other terminology you'll sort of hear as we go through. Anatomy is the study of body parts. When we talk about gross anatomy, we're talking about the study of notable structures that are visible to the naked eye. So the big anatomy, so us. So things like that are on our bodies. Microscopic anatomy is the study of structures that are too small to see unassisted. So we need microscopes to be able to look at them. Histology is the study of tissues, and cytology is the study of cells. And so, again, we're not going to get into all of this stuff, just to build a little bit of an awareness that there are so many different areas of study that people focus on. We are going to Physiology is the science that deals with the function of cells, tissues, and organs in living creatures. Pathology is the study of disease processes, including changes in structure and functions of the body. So pathologists look at certain diseases and what is it that's happening in the body, what's happening to the cells in the body to cause that disease. So for example, a pathology report or a pathologist might look at a cancer cell and try to sort of figure out how that cancer cell is growing and what's happening and how do we treat it. Psychology is the study of both normal and abnormal processes of the mind. And so this is the area of study, and we'll talk a lot about the psychological aspects of a lot of the medications that we use in our sector. I digress a little bit as we go through this, and I apologize for that, but I always worry about not getting things out. And so our sector specifically, our sector and elderly people, working with elderly people, are the two areas where we see, again, in my opinion, way too much use of what we call psychotropic medications. And so psychotropic medications are medications that we use more or less to control behavior and to help with certain types of behavior. We see an awful lot of psychotropic drug used in our sector. So this part is really, really important. Understanding what it is that we are administering to people, what it's doing to them, what some of those longer term side effects are, really, really important in our sector. Psychotropic medications are far overused, again, both in our sector and in long-term care, working with the elderly, say somebody with dementia. And they have significant impacts on people's health. They have significant impacts on their quality of life. And we'll talk about all those things again a little bit later on, but really important for us to recognize that. So pharmacology. So a drug is, so we're going to focus now just a little bit on the pharmacology aspect, not those other things that we talked about. And I'm sorry, my hands are flying all over the place. I'm Italian, I can't help it. I thought maybe it would be better because I wasn't, you wouldn't be able to see my whole body, but clearly I can still manage to get my hands up there. So a drug is any substance that's used to diagnose, treat, cure, or prevent diseases. And so we use drugs for a number of different reasons. We oftentimes think about that treatment piece or that cure piece, but drugs, different types of drugs, different types of medications, prescription and non-prescription, are used in other ways as well. And sometimes it's preventative. So things like vitamins and minerals, those kinds of things might be preventative. Things that we might use to diagnose different types of diseases or conditions. So there might be, a doctor might have a hypothesis of something that he thinks might be going on with a person. And this is something that we see in our sector a lot. We see a certain type of behavior. We think this might be because the person is, say, depressed. So we might prescribe an antidepressant to a person and then watch their behavior and see if it changes. In that way, we can use medication to diagnose if that person isn't able to help us by talking to us about how they're feeling, for example. Also used for contraceptive purposes, so to prevent pregnancy, for health maintenance, and for palliative care. So even when the drugs that we're administering to people aren't going to be helpful anymore to cure people, they can be used to make people more comfortable, and they can be used to ease people through their final stages of life. So all kinds of reasons why we use medications. So there are different drug categories that we need to be aware of. So controlled substances, you'll hear that term used in our sector for sure. And these are drugs that have special restrictions on them as to who can prescribe them, who can sell them, and how often they can be prescribed. So the types of drugs that are often controlled substances are drugs that may cause some sort of dependence, for example. So drugs to treat pain. There are some medications that are pretty powerful drugs that are used to control pain, and so they are controlled. So a person can't just keep refilling a prescription over and over again. If that drug has been prescribed by a doctor that it can be taken twice a day, then it's actually timed out so that a pharmacist will not dispense that medication if it looks like that person's taken more than what the doctor allowed them to take. There are also doctors who don't have privileges to write controlled substance prescriptions. Sometimes it's by choice, sometimes it's not. Sometimes doctors lose that privilege if they've not used it appropriately. And sometimes it's by choice. Some doctors choose not to prescribe that type of medication because there's a great deal of follow-up that's required with patients who are taking those types of medications. Then there's over-the-counter drugs, and so these are the drugs that you and I can walk into Shoppers Drug Mart, Walmart, Safeway, wherever, and actually buy over the counter. We may have to ask for them. So, for example, Tylenol 1s or Tylenol 2s are over-the-counter versions of Tylenol because they have extra medication in them for pain. So they have a small amount of codeine, for example, in them. You can buy that without a prescription, but you won't find it on the shelf. You actually have to ask. 1 second, I saw that pop up and I didn't have a chance to finish reading it. So I'll actually get whoever that was to speak in a second. So those types of medications you won't be able to buy off the shelf, but you would be able to buy it if you ask the pharmacist for it, because they keep it behind the counter. You can just buy straight up Tylenol off the shelf. So they don't require a prescription, but they are controlled in some way, because then the pharmacist is able to give some education to the person who's purchasing that medication. So that's an example of an over-the-counter drug. Okay, so somebody had a question. It had something to do with long-term care, or maybe it was just a comment, but go ahead and turn your mic on.
Different, right? I want to ask.
I'm not sure who it was. I missed it. So just so you guys know, because I'm not sure what you guys see exactly, but when somebody does put a comment up, it sort of flashes in the corner of my screen. And by the time I kind of get drawn to it and I'm able to read it, it often disappears and I miss it. So I didn't even catch who it was that put the comment up there or question up there. So if you have a question, please just jump in and use your mic.
Okay. Don't you...
It might have just been a comment about the fact that these medications are used often in long-term care, and they are. So I'm not really sure if it was a question or a comment. Anyway, I'll move on for now, but please pop in if you do have a question. Don't be shy. People will probably appreciate hearing somebody else's voice and not just mine. So then prescription drugs are also known as legend drugs, and you don't see that very often, but I do like to mention it because there are some, doctors out there who may still use that term. It's ancient, but there are ancient doctors out there. So they are also known as legend drugs. In some of your research, maybe when you're doing your assignment, you may come across something like that. Most of the time, we just refer to them as prescription medications. So these are medications that require a doctor's prescription. And a doctor's prescription could be written or it could be oral. So doctors can just call in a prescription to a pharmacy. They don't necessarily have to just give you a little piece of paper. And that prescription is needed in order to buy or sell that medication. So in order for you to get your hands on that medication, you need to have that prescription. But not only that, that prescription has to be kept at the pharmacy. So the pharmacist has to have that prescription in order to dispense it. So you can't just walk into a pharmacy and, flash your prescription and say, doctor said I can have this, and then put it away. You actually have to give them that prescription, and they have to keep that on file for a certain number of years in order for that prescription to actually be filled. So we're also going to hear the term therapeutic effect, and we'll hear this term a lot. So therapeutic effect is what the intended, desired, or predicted physiological response is to an administered drug. So basically, it's the underlying reason for that medication to be prescribed. And so the therapeutic effect is what we're going to be looking for in the people that we're supporting after we administer their medications. So depending on what the medication is, it's typically most important to look for these things when a medication first starts to be administered to that person. So when the doctor first prescribes it. Once we know and understand what the therapeutic effect is, we know that that medication is effective, then we're not looking so much for the signs that it's effective. But we actually start looking then for the signs that it's ineffective. So what's changing? Once we know a drug is working and it's therapeutic, then we start looking for changes in that. But in the very beginning, the things that we're going to be reporting on, so you're going to support somebody to go to a doctor's appointment. The doctor's going to say, okay, and I'm going to use mental health related things a lot because that's where my experience is. But it could be for anything, where, you know, the doctor's going to say, okay, this person we think might be, you know, showing some signs of depression. I'm going to prescribe this medication. You're going to go back to that same doctor in 2 weeks with that same person. Hopefully there's some consistency, and the doctor's going to say, was it effective? So we're going to learn about what it is that we're going to look for. So what was it that the doctor wanted to see? And you should always be asking those questions, right? So, okay, you've administered this, you've prescribed this antidepressant. I'm going to administer it. What am I looking for? What am I looking for in this person so that when I come back, I can say to you, yes, it's effective, or no, it's not effective. And so those are some of the things that we're going to learn about later. So therapeutic effect, really important to be paying attention for that and for knowing what the therapeutic effect is supposed to be. We're also going to be looking for secondary or side effects. So secondary effects, side effects, interchangeable terms. You will most often see side effects. Sometimes you'll see adverse effects, a little bit of a difference in that sort of definition. But these are the effects of a drug that are other than those for which it was prescribed. So these may be positive, they may be benign, or they may be adverse. They could be good things. And so earlier when I talked about the fact that sometimes we administer medications for reasons that it wasn't really intended, but we recognize that it does something, this is usually how that happens, is we've administered a medication and we've watched for long enough that we recognize that people actually have a side effect of that medication that's a good thing. And so one example that I can think of off the top of my head, and I think of this example because I did a big paper on it when I was in school, but there's a drug called topiramate, and topiramate is an anti-seizure medication. That's what its therapeutic intention is. The therapeutic effect of topiramate is supposed to be to stop seizures from happening, to prevent seizures. However, one of the things that they noticed over and over and over again when they were prescribing topiramate is that it reduced appetite in their patients that were taking it. So topiramate is now used off-label, because it's still considered an anti-seizure medication, or an anti-epileptic, we often call them. It's now also used as weight management for people who are struggling to maintain a certain body weight or to lose weight. So it's used as an appetite suppressant. So that's an example of that. So sometimes we see side effects, and it's okay. Side effects are a welcome thing, but they're not always a welcome thing. And often side effects are things that actually cause people a lot of discomfort. They can be benign in the way that they might be uncomfortable, but they're not going to harm the person. And so we just kind of watch for those kinds of things. Things like maybe, diarrhea, headache, those kinds of things that people, in a few days, they kind of, ease themselves out and are a little bit better, and people are able to tolerate those kinds of side effects. But they can also be adverse, which means that usually you have to switch that medication because it could be something that's actually harmful to that person. Things like blurred vision can be really, depending on the person and whether or not, and what they, say do for a living. Blurred vision might be something that's, too much of an impact for them to be able to tolerate it. And so you may say allergic reactions to medications or adverse. Okay, before we move on, how are we doing? Anybody have any questions so far? So we'll try to go for another 10 minutes or so. As always, these slides always take me way longer to go through than I plan on. So I don't know that we'll even make it through this entire PowerPoint before I let you go. What if we try to go for another 15-20 minutes? We'll get as far as we can, and then I will ask you guys to Ariel, go ahead.
I was just wondering about the different types of anatomy, like the subcategories. Will we need to know that for any testing, or is it just information that we can know for future references?
There might be a couple of questions. I'm trying to remember. I don't have the tests totally memorized, so it's hard for me to answer what exactly is going to be on the test. There's probably a couple of questions about what those different things mean. Closer to the test, I can give you a better idea, Ariel. I'd have to actually pull it up and look at it.
No problem. I'm just reading along with the textbook, and it just doesn't mention any of the subcategories.
Yeah, some of it isn't going to be in the textbook. So that's actually, I'm glad you brought up that point. Some of the PowerPoints come directly from the publisher that I'm going to be using. And that stuff will be right out of the textbook. Other stuff like what's on this particular PowerPoint, there are some different sort of things in there. So just be aware of that. You'll be able to tell by the way the PowerPoint looks which ones are the ones that come from the publisher and which ones don't. And I can share that information with you anyway. You will have access to all the PowerPoints though. So I will leave them posted in Blackboard, again, under content for this particular course, so you will still be able to look back. There is definitely going to be stuff from this PowerPoint on the test for sure. Okay. Do you have another question, Ariel, or is your hand just still up?
Sorry, I took it down now.
Okay, yeah, that's okay. That's okay. Okay, so what I was going to ask is, do you guys want to go another 15-20 minutes and then we'll call it a day, or do you want to take a quick break and come back? If I can have a couple people answer that, that will help me to sort of decide. If you want to power through, we can power through a few more slides and then wrap the slides up next week. Or we can try to make it through this and take a break and then go till the end of class.
I'm okay if we continue going.
Okay, everybody else? How about a show of hands for those that want to continue? Usually people say they want to continue. Okay.
I say up to you.
Perfect, awesome. Okay, so let's do this, folks. Let's try to get through a few more slides. We'll kind of not focus too much on these next few slides. This is just sort of information that's interesting to have. Again, probably not really much that you'll find stuff that you remember later on anyway. So this is drug sources. So this is the different places that we derive drugs and medications from. So drugs can come from plants. So there's all kinds, there's a huge list, but there's a couple of more common sort of examples. Again, please forgive my pronunciation. This is so embarrassing. It doesn't matter how many times I practice. If somebody out there is good at this, feel free to jump in and correct my pronunciation. Ariel.
I know how to pronounce the first one. I don't know about the other ones.
Awesome. Please say it for me.
Papaver somniferum.
Awesome. Papaver somniferum. Awesome. Thank you. So this is a source of opium, which is a precursor to morphine and heroin. So that's one example of a plant that is actually where a very specific medication comes from.
He cannot roll now.
Digitalis lanata, wildflower, or it is a type of wildflower, also known as purple foxglove, which is so much easier to say. That's used to create treatment for congestive heart failure. And Atropa belladonna is used to manufacture scopolamine and to treat seasickness. So scopolamine is a medication that's used to actually dry up saliva. They can treat seasickness with it, intestinal cramping, and it's also used as an adjunct to narcotic painkillers because narcotic painkillers often have those side effects. So some of the side effects that we see in medications, we use other medications to treat. So again, the list goes on and on and on. I'm sure you all have examples of different plants that we use for different medicinal purposes. Another common drug source is animals. So a couple of examples here is Premarin. So Premarin is an exogenous estrogen that's derived from the urine of pregnant mares. And insulin, most people are familiar with what insulin is. Insulin is used to treat diabetes. And originally, insulin was actually taken from the pancreas of animals, and most often it was taken from pigs. When we talk about this stuff, I often wonder what happened to help somebody to learn that this would be helpful. So, for example, knowing that Premarin comes from the urine of pregnant mares, how did that actually happen, and what kind of caused that scientist or researcher to say, I wonder if this will work. It always interests me. But very glad that people have learned some of these things, because some of these things have certainly changed our lives and increased the number of years that we live because we know these things. Another drug source is minerals. So one of the most common examples that we see for this is lithium. It's used as a psychiatric drug that's indicated in the treatment of manic episodes of bipolar disorder. And it's also used as maintenance therapy for individuals diagnosed with bipolar disorder. And so lithium helps to bring a person down when they are manic or their mood is elevated. So there might be an increase in their dose if that happens at that time, but people with bipolar disorder are often on lithium all the time because it's used as a maintenance therapy, and it's used to prevent them from having those mood swings. So it's a mood stabilizer. Magnesium sulfate is indicated in a number of circumstances, so it's used to prevent in the prevention of labor to delay preterm birth. It's used in the prevention of cerebral palsy in preterm births, and it's used in the treatment of eclampsia, which is high blood pressure during pregnancy. The final drug source we're going to talk about is chemical or synthesized. This now is probably by far the most common source of medications. And so many of the medications that were originally derived from things like plants and animals and minerals, researchers and scientists have now discovered ways of creating those things using chemicals, as opposed to using those sources. So as sources become more and more depleted, we now have synthetic versions of those drugs. And one common one is insulin. So insulin is more often now prescribed in its synthetic form than it is in any kind of a natural form. So sulfonamide is the basis of several groups of synthetic drugs that are indicated for use of as antibacterials, diuretics, anticonvulsants, and antidiabetics. So those are typically the types of drugs that we have synthesized or made into synthetic versions. Biosynthetic human insulin, again, we just talked about a little bit, is more easily manufactured and has largely replaced animal-sourced insulin in many but not all cases. So there are still cases where people don't respond well to synthetic versions and they do use the natural derived version. But more often than not, insulin is going to be something that's synthetic. So drug standards. So in Canada, drug standards have to be met in order for those drugs to be able to be prescribed, sold, and administered. And so every country has its own sort of standards of medications. Other drugs, other than synthesized, was in its pure form. In most cases, yes. So they'll go through so somebody, I'm sorry, and I missed the name because I was reading the question, asked if all other drugs are in their natural forms, if they're not synthesized. Yes and no. So there is a process to make those medications usable to humans. So in that way, they're still synthesized. There's still a process that they go through to turn them into medication, so to speak. But their source, or what they're made of, is that natural, is the natural source. Does that make sense? So for example, if it's urine that's the drug source, then you're not actually administering urine, but urine will be the ingredient in it that we then manipulate to make the medication.
Okay, thank you.
Yeah, okay. So all countries have their own drug standards. We'll talk about Canadian drug standards here, but there are medications that that we might see administered in Canada that aren't administered in other places. We most often we have some pretty stringent rules in Canada, so oftentimes there's medications that you can purchase, say, over the counter in the States, that you need a prescription for in Canada, and it's just different standards of practice, different rules around those medications. Not only does it dictate whether or not a medication can be bought or sold in a country, but we also have standards that indicate how those products are made and what those ingredients have to be and how pure they have to be. So all preparations using the same name. So this is one area. So if a drug is being called something, it has to be uniform in strength, quality, and purity. So there's those three areas have to be the same across the board. So the most common example I can think of for this would be something like acetaminophen. So acetaminophen is another word for Tylenol. You can buy, if you need a medication to say, for example, help with a headache, you don't have to buy Tylenol brand. You can buy acetaminophen no-name brand. You can buy a brand made by a different company that's still acetaminophen. In order to be sold as acetaminophen, that drug has to have the same strength, quality, and purity as all other acetaminophens, even if it's sold under different things. Okay, so if you buy acetaminophen, regardless of the brand that you buy, you are getting acetaminophen in the same form because of our drug standards. That's one example. Okay, so DSWs and medication administration. So we kind of touched a little bit on this before. For me, this is one of the most important areas that we talk about because it's the part that I can't stress enough in terms of what our responsibility is. It's a pretty awesome responsibility. It's a pretty great responsibility to administer medications. And I say this not to scare people, but I say this because I really want you to know and understand how important this is. When you're administering medications to people, you have the power in your hands, if it's not used correctly, to do a great deal of harm. Medications, and again, I kind of alluded earlier to the fact that we use a lot of medication in our field, a lot of really strong medication in our field, oftentimes in the name of controlling behavior, that has some really, really significant side effects and impacts on the human body. And it can make people really sick. So because we're working with a vulnerable population of people who don't always know and understand those impacts themselves, so we have to try our best to make sure that they do understand that when they can. But not only that, we work with a population of people that aren't often able to tell us what that medication is doing to them and how it's making them feel. So really important that we have a sound basis of understanding what we need to look for in terms of knowing that we've safely administered a medication and that that person isn't going to be impacted negatively by that medication. So again, really important, again, not necessarily to scare you, or maybe to scare you a little bit, I don't know. It really, really important. So never administer a medication if you're not feeling completely comfortable with that medication and understanding what that medication is going to do to people. Once you pass this course, so this course is a prerequisite for your placement when you go out into the community. Even after you've passed this course, though, you'll have a required amount of time that you'll actually watch somebody administer medication. You'll learn about medication specific to the people that you're going to be working with in your placements, and you'll have some time to kind of study that. But again, please make sure that you're asking the questions that you need to ask to know that what you're doing isn't going to be harmful to that person. There is never, ever, ever a stupid question when it comes to this kind of stuff, because it's all really critical. Okay, enough about that, although I won't promise I won't mention it again. So sound knowledge is really important, and it's our responsibility. So beyond this class, beyond what you're going to learn here, because again, this is sort of an overview, sound knowledge, it really includes knowing the person that you're administering the medication to, the reason why that specific person is getting that specific medication, and what that medication might do to that person. So the sound knowledge we're talking about in this course is a little bit more general than the sound knowledge we're talking about when you're actually working in the field. When you're working in the field, it is going to be really important and your responsibility to learn all of those things as they pertain to the person that you're supporting. And that's going to be a brand new thing that you're going to have to learn each and every time you're introduced to a new person, and each and every time you are being asked to administer medication to that person. Okay, so this is an ongoing process that you're always going to be learning about. It's also your responsibility to make sure that you've got some well-developed skill. So we help with that by testing your skills in terms of actual physical administration of medication. But beyond that, again, we won't be able to test every possible situation. So there's all kinds of reasons why your administration of medication might look different in different settings. So you may be working with somebody who has been impacted by a stroke, for example, and the way they swallow medication is very different from another person. We may not cover that person, their particular way of taking medication in this course. So really important that you learn how you do it in that particular situation. So there's going to be variations on everything that we learn, not just in this class, throughout this program, where you actually have to get to know the person and the specifics around that person in order to do your job well. An informed judgment. So this is another area that is really important for us and that we like to draw attention to, because it's what kind of separates us, again, from some of those other professions. And so the informed part comes from things like this course and other courses that you're going to be taking. You'll sort of take your knowledge and you'll kind of, put it all together from some of the other things that you're going to be learning in other courses. But there's going to be times where you're actually going to have to make decisions about whether or not you administer a medication or not administer a medication. And we want you to be able to make those decisions in an informed way, which is the other reason why we try to give you as much information as we can going out there. So one of the times that you'll be using this, and probably where you'll be using this most often, is in your decision of whether or not to administer what we call a PRN medication or an as needed medication. And we'll talk about that a little bit more specifically later for those of you who might not know what that is. But in general, that's a medication that we use to as needed on the spot. So not a medication the person is prescribed to take every day, but they might need, so acetaminophen or Tylenol is a PRN for, say, for example, a headache. You only give it when that person has a headache. They don't get it necessarily every day. Some people do, but those are exceptions. We use a lot of PRN medication in our field, again, to help people to manage their behavior. So we want you to be able to make an informed choice about whether or not the risk of giving somebody a PRN medication outweighs whatever is happening, whatever that situation is that's happening. So that's going to be something that's really important for you also to recognize. So how is this medication going to impact this person? Are there going to be other side effects to this medication? And is it going to be worth it to help support them through this particular situation? So that's the area where we're going to want you to use some judgment. And hopefully you're going to learn some things within the context of this course and in this semester and in the program in general that will help you to make those decisions. Okay, so we kind of went into this kind of stuff already when I was on that slide, so I'll just kind of go through these quickly. So sound knowledge. So again, frontline staff has to possess relevant and current information about each medication that's prescribed to the individuals they support. So again, not only knowing general information, but knowing specifically about the medication that person is on, why they're on that medication, what it does to that person. How do we know it's effective? How do we know it's not harmful to them? Okay, so that's sort of in that area of sound knowledge. One of the ways that we ensure that, too much into this today, we'll talk about this again for sure, but one of the areas where developmental services has changed a lot over the years and from I mention, and I will mention this again, in this course, we will, or I will, teach you from a best practice perspective. So I will teach you what the best practice standards are in our sector that isn't necessarily what you're going to see out there. Because developmental services is not a registered profession, we don't have a professional college, there's going to be some variation in some of this stuff that we learn because each particular agency is going to do things a little bit differently. There's not sort of a standard way of doing things. It's my hope, it's my dream that someday before I retire, I see DSW become standardized and become a professionalized field. I think we deserve it. I think we are a specialized enough service with enough skill and knowledge that we should be standardized. We should have a body that we answer to. We are working with a vulnerable population of people. So this is an area that I struggle with, knowing that you're going out there and it's not always going to be exactly how I teach you, but I am going to teach you from a best practice perspective. For me, best practice means every person that you work with should have a drug card or some way of knowing this information. Meadow, go ahead.
I just have a question. So since we're not a standardized job, is there any kind of like protection against us when we're administering medications if something doesn't go the way that we plan, or like if there's a med error or anything like that?
Yeah, so that again is going to be very specific to the agency. Med errors they're really serious. Again, the other reason why this course is so important, because we help you to understand how to prevent medication errors. So I guess the short answer to that is no. If you make a medication error, it will be up to the agency that you're working for to decide how that is handled. It'll depend on what the medication error is, what the outcome of that medication error is. Medication error is such a huge there's so much variation, right? So a medication error could be as simple as not simple, but because any medication error is serious, but it could be forgetting to sign off on a medication. That's considered a medication error, and that will have a certain consequence. But it could be administering the wrong medication to a person. And I will tell you some stories as we go along, again, not necessarily to scare you, but to put some awareness that this happens. But if somebody gets the wrong medication, it could potentially make them very, very, very sick or worse. That type of a drug error, there isn't going, it could have legal consequences. It could have legal consequences, absolutely. So I guess the answer to your question is no. But there are different consequences depending on what the medication error is. Does that help?
Yeah, thank you.
Okay. So some of the things that we need to know about the medication that you're going to be administering, and what should be included in writing so that all staff members have access to this so that they don't have to look it up when they're coming on, is the name of the drug, the classification of the drug, so what that drug, like what type of drug it is. So for example, it could be some type of an antidepressant, so citalopram, classification would be antidepressant. Action would be what it is, so that therapeutic effect. So what is it that you want that drug to be able to do? So what is that drug going to help that person with? What that drug is used for that particular person. Again, this would be personalized about that medication for that specific person. Important to know the dose of that medication. So how much of this medication are you administering? And again, really important to know interactions and side effects. So what are some of the things that you might see? And more importantly, what are some of the things that we have seen in this person? So has that person had a specific side effect to this medication in the past? That needs to be documented. Number one, because you might not panic as much if you see it, because you know it's been looked at already, you know that it's probably been reported to a physician by now, but also if there's a change to that. So if the person starts having different side effects than what they've typically had to that medication, and that can happen for a variety of different reasons. So one of the things that happens in our field is we get complacent and we administer the same medication to that person every day for years and years and years and years. And we stop looking for these things. But things change. Things change with people. They are a different age now than they were when they first started taking that medication. They might be a different weight. They might have started taking different medications. They might have stopped taking other medications. And all of those things change how that particular medication is now being used in that person's body. So we can't stop doing this. We have to keep learning and understanding about that particular medication in that person. And so again, you'll see that a lot, and you'll hear that from staff. You'll ask a question and staff will be like, they've been taking this medication for 10 years. I'm not worried about that. You should worry about that, because 10 years is a long time to be on a medication, and lots can happen in a person's physiological internal state in 10 years. So always being diligent, always being on top of it is really important. So again, drug-specific information, important. Proper storage and handling. So Does this medication have to be refrigerated? Does this medication have to stay out of the light? Those kinds of things, really important, because otherwise, if we're not storing medication properly, we're changing the effectiveness of that medication. We could be poisoning people if we're not storing medication properly, because it's actually chemically changing that particular medication. Being aware of any special instructions that we might have for administering that drug. So a common instruction might be an hour before eating. Really important, because if a medication is supposed to be given an hour before eating and you give it to that person with their supper, it's probably because that medication binds to food and then just gets eliminated. So it actually isn't doing what it's supposed to be doing in that person's body. So there's a special instruction for a reason, and it needs to be followed. And that's another thing often in our field that we see, is that we get so stuck on, it's a supper time med, that med's supposed to be administered at 5 o'clock. Well, today we're having supper a little bit earlier, so we haven't given it that hour. And people kind of forget about that. They forget that it's important that you're very aware that then you need to move that medication time. If you're changing supper time, then you need to move the medication time. So things that we tend to forget those things if we're not revisiting them very often. Also really important to know the ability to communicate this information to supported individuals, their families, or other members of your team. So again, it's incumbent upon us to make sure that the people that we support are as educated as we can help them to be about what they're taking, what we're giving to them, and what it might do to them, what it's supposed to do to them. You need to be able to report on symptoms so that when you go to a doctor, you can say, this is what I'm seeing. This is how many hours after administering medication I see this. Those kinds of things are really important for doctors to know, because the decision of a doctor to prescribe a medication to a person that we support, particularly when that person doesn't communicate well on their own, relies heavily on what you tell them. So doctors will make decisions about what they're going to administer and prescribe to the people that we're supporting based on what we're telling them. So really important that we're able to communicate this information effectively and accurately. Okay, I think that sounds like a really good place to start, because now we're going to go into some different stuff. We will kind of revisit those types of things that we talked about today a number of times throughout. What's always interesting for me, hang on, I'm just going to stop sharing this slide for now. I don't know how to do that because it won't open here. Interesting. Okay. Maybe here. There we go. All right. What's interesting is to see the level of anxiety change in students as we move through the course. And so again, that's another thing I'm really going to miss not being face-to-face with you guys. But as we go through the course and you start to gain some knowledge and you get a little bit more comfortable in your knowledge of this topic, I start to see anxiety come down and confidence go up, and it's beautiful. You will learn the things that you need to learn to be able to administer medication safely, I promise. And by and large, you will all be comfortable with it really shortly after you start doing it with each individual person. I just never want you to forget how important this skill is. And I don't want you to get complacent, because it will always be important to know the things that we're learning about each individual person. So I just want you to kind of be aware of that. And you are advocates for change out there when you see staff who've been around for a very long time getting complacent and not paying attention to some of the things that I'm telling you are super important to pay attention to. I hope you have the confidence to be able to speak to those things. And we'll talk about how we do that in a safe kind of way also as we go through the program and through the course. All right, folks, any questions? I know that was like big for today, lots of talking. Any questions about anything we covered today or anything that you're worried about? if you like. I will stay on until I see that everybody's gone out of the course room. If you have a question that you are too shy to ask in front of everybody else, or you just want to ask me a question, just stay in the room. I'll notice that you're still in the room, and I won't leave until everybody's gone. Okay? Have an amazing day. Enjoy the rest of your week, and I will see you all next week.
I think you add something just like that.
You are so very welcome. Can't wait to see you guys next week.